Hello, I'm John Kanellopoulos from Athens, Greece, an anterior segment surgeon and clinical professor of ophthalmology at NYU Medical School. It is my pleasure to present to you a technique that we introduced back in 2006, prophylactic cross-linking in routine LASIK cases to enhance the biomechanical instability that LASIK creates. It is now named LASIK Xtra, and it is a pleasure to use the technology that made it possible in an everyday practice, which is made by Avidra. Thank you very much, and I'm sure you'll find this video very interesting. So we'll see in this schematic first here the creation of the flap with a femtosecond laser, lifting the flap, performing the routine excimer laser ablation, as you can see here. And now, before the flap is placed into place, riboflavin solution 0.1% onto the stromal bed for a total of 1 minute. We will see a clinical case in just a few seconds. So this now, the bare stroma exposed after laser procedure and slightly dehydrated if you may, will soak into the riboflavin solution very fast. The excess after the minute of riboflavin is rinsed away, the flap positioned in place, and this will greatly aid in avoiding possible DLK from imperfections within the riboflavin solution. And now some of the riboflavin is absorbed on the flap part. Then the CXL cross-linking device by Avidra is centered on the eye, and 30 milliwatts are placed onto the cornea for a duration of just 1 minute. And this device is extremely eloquent. We had described this technique initially using 10 milliwatts for 3 minutes, and obviously this shortens the procedure. This is the patient preoperatively, and now the laser with an Alcon refractive suite. You can see the FS200 excimer laser and the EX500 excimer laser. State-of-the-art equipment for LASIK today. Here the FS200 femtosecond laser will be applanated onto the cornea. The final tuning of the actual placement of the femtoflap take place. Now the femtoflap begins, and in an astonishing time of 6 seconds, we have a myopic LASIK flap ready. We will then lift the flap. Here are the numbers. We will cross-link the higher myopic eye. So here we're using a single irrigation cannula as the instrument to lift the flap, and this obviously aids in becoming a single instrument procedure. We will lift the flap here and expose the stromal bed. Make sure that the hydration is homogeneous, and then the excimer laser treatment is performed. This is the EX500 by Wavelight Alcon. Both the femto treatment to create the flap and the excimer laser treatment for the 7 diopters of myopia are real time. And now the riboflavin solution placed onto the stromal bed. We'll use several drops for a total of 1 minute. And then after a minute duration, we will put the flap back into place, and then rinse excessively in order to remove any imperfections. You can see in this blue-eyed patient that there's significant riboflavin retained within the stromal bed. And this is the KXL Avidra device, preset at 30 milliwatts. It fits very nicely snug between the femto and the excimer laser. Patient in supine position, still in the refractive suite bed. Treatment takes place, cornea, the next day, perfect, pristine 20/20 vision. This is the cornea topographies a week later, and on OCT, slight hyperreflectivity at the area of the flap. Again, before and after, a perfect result, enhanced for stability with prophylactic cross-linking. Thank you.